Truck Month is back at Denoyer Chevrolet, and we're unveiling a deal like never before. Put yourself in the driver's seat of the all-new 2014 Silverado LT Double Cab. All the comfort you like, all the power you need. For just $269 a month, get the advantage of Denoyer's huge selection, quality service, and our exclusive Tires for Life program. Find new roads at Denoyer Chevrolet, Stadium Drive, Kalamazoo, or scroll our lot at denoyer.com.
Well, last summer I engaged on a journey with my three boys. We started with the Eric Zapata Run, the Easy 5K, and our goal was to run 20 races in 20 straight weekends. So about mid-August, one of my races was the marathon up at Bayshore, and by mid-August, beginning of August, my hip was really, really bunged up. So I told the doc, I said, I really don't want to know until we finish our 20 races. So the Monday after our last race number 20, I had an MRI, and the MRI found all kinds of really bad things, and the radiologist's comment was, what type of painkillers are you taking? Are you being prescribed? And I wasn't taking any, but it was in really bad shape, really bad shape. So I had no intentions on getting a hip replacement. I thought I was too young, and I made appointments throughout the state. And the first doctor I found that totally understood my goal to run again, I immediately scheduled my surgery. And I didn't think I'd get a hip replacement, and he kind of laughed at me. He said, you can run with a hip replacement. So he said, in fact, he told me I could be up running in as little as 6 weeks after surgery. Oh, it was long. I had to work really hard prior to surgery, strengthening it, did a lot of physical therapy, a lot of things to get in shape pre-surgery, and then after surgery, I was okay to start walking and riding a stationary bike at 2 weeks, and I immediately jumped in that. I was walking 8 miles by the time I was okay to run again. So I just kind of jumped back in it. I really had to listen to my hip, the pain. If it was bothering me, I had to stop. There's certain days I could go 8 miles, some days I'd get 3 miles out and realize, okay, this isn't good. And the same thing with my running coming back. There were days I could go out and run, slowly coming back. There's days I could go out and run 2 miles and feel horrible and just quit. And there's days I ran 6, 7, 8 miles. And so you just kind of take it as it comes. Oh, the first half marathon, interesting. My surgeon had practiced in La Jolla, California. Now his comment to me is he encourages his patients to get back into what they want to do, and he understands their goals. And he said, if you were to ever run a half marathon again, which I would never suggest to my patients, but I know they're going to do it, he said, La Jolla is a beautiful half marathon. So that was within 6 months of my surgery. So I kind of set that goal, okay, I'm going to try to run La Jolla half marathon, because that's where he was from originally, and he said it's the most beautiful half marathon in the country. So I, got up, and I pulled the trigger a month before the half marathon, signed up, and got my airfares because I thought I could be ready. I kind of took it slow and easy. The hills were brutal, but having that goal to be back to a half marathon within 6 months, and that fell within my goal. Now I thought I might be able to run the 5K afterwards, but I'm feeling good enough that I'm going to run the half marathon this weekend. I've run the Kalamazoo half marathon before, and it's a hilly course. Yeah. And I always thought, wow, this is a really hilly course, until what I experienced last weekend at Bayshore. In fact, Blaine Lamb warned me. He said, oh, you're in for a doozy, because that thing is some big hills. So I don't know specifically the heights of the hills. I know the Mount Olivet's a good challenge. But shooting the middle of my race at mile 6, I had to climb a 440-foot hill. And when you think about that, that's like 6 miles in your run climbing a 44-story building. So it's quite a challenge. And Kalamazoo has some challenging hills. So I feel like I'm kind of excited. I've still got to take it easy, listen to my body. But just being able to run again is just, having a hip replacement, and having the ability to run again. As I told my surgeon, I ski with my boys, I have 3 boys, and I run with my boys. And I said, I just want 10 years, because that's how much longer before they're off to college. And I said, I just want 10 years. He said, I'll give you 20 or more. So it's just great to be able to run again. I ran the Winter Blast. But that was my first race back, the Porter's Winter Blast. I just ran the 5K. And I ran the Easy 5K, and I've had some great runs with my boys since then, and I just look forward to another summer of running with my kids. It's just a great experience. Like I said, I run with my kids, I ski with my kids. Within 4 months of my surgery, I was skiing in Breckenridge, Summit County with my boys, doing black diamonds. And the doctors won't okay me to do double black diamonds, but it's a great, there's not a better sport to do with your family than running and skiing, and I got to do both. Yeah, my family, we just run. It's just I've always encouraged my kids to run. Running's a lifelong sport. You do it, and I wasn't a runner in high school. I played football, but I just picked it up shortly after college, and it's just something that once you do it, if you get the bug, you'll always do it. Now I had hip replacement. The hip replacement wasn't from running. A lot of people, and sometimes when somebody says, oh, you had a hip replacement, it must have been all that running you did for all those years. I'm like, well, no, there's some family history there, and chances are, my new hip feels so good. I have to call it I have my fake hip and my natural hip, because I can't call it my good and my bad, because people assume my fake hip is my bad hip. Well, now my bad hip is my natural hip, and I fully anticipate probably needing my other hip replaced in November. And if you would have told me a year ago that I was going to have a hip replacement, I would have thought you're nuts. But I got one, and it feels really good. Well, specifically for hip replacements, you find a doctor that understands your goals. And there's doctors here in Kalamazoo, there's doctors all over Michigan, there's doctors all over the United States. I just had to get it done in a time frame where I could be running. I wanted to go on Christmas break family trip. Well, so I had to get it done in November, but I also knew I wanted to be back up and running by summer. If I couldn't find a surgeon that was going to do that, I was prepared to wait another year, because when you look at your kids, life goes so fast. I didn't want to miss a summer of that. So my biggest thing is finding a doctor, scheduling it, finding a doctor that fully understands your goals, and getting it done, and then listening to your body. Once you're recovering, make sure you're listening to your body, because it's not 100, mine's not 100% back to normal. I'm not running the speeds right now that I used to, but I'm getting there. It's improving every day, and it's just great to be out, and especially now that all the snow has melted. For having a recovery winter, I think I picked about the worst winter possible to come back. But boy, I was out, every other day or every 3 days. I couldn't go every day, and I'm still not up to that yet. I still have to do a lot of biking on the stationary bike, and I do a lot of physical therapy. But you listen to your body, but as long as you understand your goals, and if it's to get back to running or get back to biking, or there's people who, I have friends of mine I talked to at high school who have been dealing with hip pain for 10 years, and they can't even walk the dog. And so, I call them and say, hey, make sure, if your goal is to walk the dog without pain for 3 miles, tell that to your doctor. But I said, I promise you, get in and get it done, because your life, who cares if you get it done when you're 50 or 60? Your life is going to be so much better. And I would argue, there's some expense involved, but, if people have heart disease and diabetes for not being healthy, this is a hip replacement, which is a lot better than some of the other issues that could, from not running.